Let's talk about kidneys. Kidneys is one of the most important detoxifying organs in our body. We have liver and we have kidneys. If your liver and kidneys do not work, people die within 24 hours immediately. That's how bad we depend on kidneys. Kidneys remove toxins from the blood. So all the toxins that the blood collects while it is running through your organs. And remember, it goes in the capillaries and removes every removed toxin from the cell or trapped in the cell gets dumped into your bloodstream. That blood goes through the kidney filtration. And the kidneys have to filter it. If you guys have pools in your backyard, some of you probably understand how filtration works. The fluid goes in, you must have some kind of pressure to push the fluid in, and then it goes through the filtration system, and then it comes out clean and crystal clear. So it's basically the same concept, just to simplify it. Of course, it's not as simple, it's much more complicated, but it is how it works. Now, when we go to the doctor, the regular doctors, like the primary care doctors, and when we don't even ask about kidneys, we just say, hi, I'm here for my annual. And the doctor checks, they do your blood test, they do a urine test. The blood test is to see what's your urine function, and not urine function, but kidney function is, your filtration system, so to speak. How's it working? It's called creatinine, it's called GFR. So if you have access to your metabolic profile, blood metabolic profile, you will see those numbers and you're going to be able to see the reflection how your kidneys are working, right? Your doctor probably also asks you to pee in a cup, and we send urine for urinalysis and urine culture. Why would we do that? So besides checking the filtration in the blood, through urine, we actually can see if your kidneys are filtrating too much of a protein. Not filtrating, I mean, it actually, you have a lot of protein that just being dumped into the urine. And that protein, that means your body is losing protein. The blood test called either complete metabolic profile. In the blood test that we've done on you in our office, it's usually complete metabolic profile. But the blood test that is done in other offices, it could be just basic metabolic profile, okay? So the difference between basic and complete metabolic profile is complete has liver function. Basic metabolic profile does not have liver function, it has only kidney function, okay? So the urine actually can show if you're dumping protein from your body, thus you're losing protein, thus there's something going on. It could be any autoimmune disease, it could be kidney disease, it could be some other problems where your muscles are being destroyed, whatever. You also could be dumping certain things like creatinine. And that happens in a healthy body, happens if you are someone who's going through very, very strenuous exercise, when you're using your muscle to the point that you're just dumping that creatinine, a lot of creatinine. That means you are destroying a lot of muscle in your body. And another thing that we can catch on the urine test, if you have sugar, you may not be diagnosed with diabetes, but if you're dumping sugar, that's another sign that something is not right with your filtration. Sometimes people may have bleeding or may have a little bit of red blood in the urine and they freak out because doctors say, well, we have to rule out cancer. But before cancer, a lot of times bleeding, the most common cause is either infection. If you're a menopausal woman, it could be menopause because everything becomes dry, or it could be a kidney stone or bladder stone or urethral stone. That is the most common one. But of course, if there's any blood, especially frank blood, a lot of blood in the urine, then of course you must not ignore. Like all these things, why am I telling it to you? Why I'm mentioning these things? To explain to you that these tests are important. That is the information this test carries. So you must not ignore it, but at the same time, you must not go crazy about it. The most important thing that you have to remember is awareness is the key. If you are aware, then you can take certain steps and make certain decisions where you're going to help yourself, to prevent certain conditions.